Hello everyone, I'm Dr. Nahla Hamouda from the College of Pharmacy at Rizmikhan University. Today I'm going to talk about pharmacogenomics. It's divided into two lectures, so please follow up. To begin with, we would like to know, as an example, what happens when we give the same dose of a drug to a group of patients with the same diagnosis. It means if we are 30 students in a room and I'm going to give you one single drug with the same dose, what will happen? 95% of people, and this is a natural result, will have a therapeutic effect from this drug. And 2.5%, about 2.5%, they will respond with no therapeutic effect. It means this drug did not affect them. And also 2.5% will respond with toxicity. What is the meaning of toxicity from the drug? It means 2.5% of the people will have over effect or undesired effect, over effect from this drug. And of course, this is not the desired effect. Why do you think we have this effect? It's simply because we are all different. We don't have the same genes. We don't have the same physiological enzymes. So why we are all different? Because we have two factors responsible for the difference between all individuals. The most important one is the internal genetic variation, and it's called DNA polymorphism, and we are going to discuss about this later. It means we all do not have the same DNA sequence, and this is a natural truth. The second one is due to the external factors such as environment and diet. To clarify this point, for example, if a twin, one of them is living in Japan and one of them is living in the US, so they have totally different environment, although they have the same genes because they are twins, but the way they grown up in the environment is different. So each of them will have different behavior and different characteristics. So these two causes are the reason why we all are different and we don't have the same effect of the drug. So the 2.5% we mentioned that they don't have any therapeutic effect, and the 2.5% who had an extra or over therapeutic effect of the drug, they are called the non-responders and the toxic responders. And they collected and asked these people to have some investigations to study their own genes or genomics to know why they have that different response to the drug therapy. This is the genetic map. As you all know, inside the nucleus, we have the chromosome. And then the chromosome is divided into, is made up of the DNA base pairing. This change in the base pairing is called single nucleotide polymorphism, or SNP. So the base pair is not the same in all individuals for the same gene. That's why we get a different response. So SNP is the single nucleotide polymorphism, which is the main cause for the difference in drug response. That was the first initiation or the first reason why the investigators or the researchers tried to collect the genome of a large number of people, and they compared the base sequence in all these people, and then they could make a single genetic map. So generating a single genetic map of the human genome containing all the possible SNPs or the SNPs maps. From there, the researchers could investigate and study why every people has a different response to drugs. So simply, if we want to to define what is DNA polymorphism or SNP, it's the most commonly observed variants are single nucleotide polymorphism. And a single nucleotide is replaced in the genetic sequence. As you can see in the picture, the A and T are always together and the G and C are always together. So if A and T are replaced by G and C, then this is a single nucleotide polymorphism. So the SNPs are responsible for about 90% of the genetic variation in human genome. And the different SNP expression may modify the drug's therapeutic response or adverse effect incidence. As I explained in the first slide, I mentioned that 2.5% of people has no therapeutic effect and another 2.5% has over therapeutic effect. These non-responders or toxic responders, they have underlying single nucleotide polymorphism which control how their body responds to the drug action. So now we understood the underlying mechanism. So what is the result of a single nucleotide polymorphism? As we know, the gene is transcripted and translated to make a protein. This protein is the enzyme. So for example, one biochemical interaction, the enzyme acts with its substrate as the key and lock mechanism. I think all of you know the key and lock mechanism. It means the enzyme is totally 100% fitting to its substrate. This is the normal, as you see in the slide. The enzyme has a circular space, so only circular space molecule can get inside the active site and do its biological action. But what happens if we have the SNP? Then the enzyme shape is different. As you see, the circular part cannot get into the active site of the enzyme because the shape of the active site has been changed because of the SNP. That's why the enzyme cannot perform its action, and we have altered shape of the enzyme and also altered function. So we have either non-responders or toxic responders. So how also, to summarize, how the SNP can affect the pharmacokinetics and pharmacodynamics of drug action. Regarding pharmacokinetics, and I want to explain what is pharmacokinetics simply, kinetics means movement. So pharmacokinetics means the movement of the drug inside our body. It means that the journey or the trip since the drug entered our body till its elimination in urine or stool. So we have 4 components of pharmacokinetics. We have absorption. It means when the drug enters the body, it's absorbed from our intestine to the bloodstream. Next is distribution. Distribution means where the drug goes. It goes all over the body, carried in the blood and in the plasma. Some of them can enter the cell, some of them cannot enter the cell. Metabolism means the drug, after it does its action in the body, it goes to the liver where it is metabolized. It means changing from the active form to the inactive form. So it's broken down and carried by plasma proteins to go to the site of elimination or excretion, which is the last component of the pharmacokinetics. So basically, pharmacokinetics means the trip or the journey of the drug inside our body, from the time it is ingested till the time it's eliminated outside. And also we have the pharmacodynamics. What is the pharmacodynamics? It is simply the effect of the drug on the body system. For example, I'm taking a drug for hypertension, which means high blood pressure. So what is the dynamic action of the drug? To lower my blood pressure. So this is the pharmacodynamics, the interaction between the drug molecule and its receptor to do its effect. The effect is lowering the blood pressure. So we have many variations in the drug action. We have toxicity, we have the biological effect, and the efficacy. You don't need to know these terms in details, but just I want to know they are related to the pharmacodynamics of the drug action. So what happens if we have SNPs? We get defective pharmacokinetics, which means high or low drug level, and we get defective pharmacodynamics, which means increased risk of severe adverse drug reactions. It means the drug overestimates its action, so we have undesirable or unwanted side effects. So what is the significance of the SNPs? As we understood, they are very important to determine the pharmacokinetic and the pharmacodynamic of the drug action. So we use SNPs in disease diagnosis. So if we have one kind of disease, we can detect the reason for this disease. In finding predisposition to diseases, for example, if we discover one SNP which can affect or delay the action of one drug, so we can avoid using this drug in the future. So this is called predisposition. We can discover the disease before it's happening. In drug discovery and development, we can modify the drug action to use elements in the body which are not affected by SNPs, so we can develop the drug. It means we increase its action and make it better. In drug responses, when we discover a new drug and we try to find its all biological effect, if there is an SNP, we can decide or discover the possible side effects of this drug. So all these aspects will help to look for medications and the diagnosis at individual level. The new era now in pharmacotherapy is to design a drug that is suitable for the single individual patient. I mean, each person should have a drug that is suitable for his case. So to overcome variation in drug responses by personalizing medicine. As I said, it's choosing the best drug suitable for this patient. So I want you to remember what is the key for the individualized treatment with drugs or the personalized medicine. We have to remember the 5 rights: the right dose, the right drug for the right indication, for the right patient at the right time. If we try to make all these 5 parameters in a correct manner, then we can get the optimal drug effect with no overestimation or underestimation of its action. So that was the end of Pharmacogenomics 1. Please follow up to Pharmacogenomics 2.